Thank you for joining Beacon Partners for another edition of Healthcare Minute. In late 2011, Beacon Partners conducted an original research study to assess the status of healthcare organizations' participation in health information exchanges, or HIEs. Over 200 healthcare executives took part in the study. More than half were CIOs. The study confirmed that in most organizations, the CIO is responsible for HIE development. However, strategy is generally established at the board level. This is important because the ability to tie structure to strategy is critical to successful HIE development. As expected, responses were varied when it came to current or proposed governance and organizational structure. Participants reported a range of governance models, from having a board of senior executives from different stakeholder organizations directing the HIE effort, to having a board comprised of executives from a variety of participating organizations overseeing things. Strategy is also important when it comes to funding. The survey confirmed that high startup costs are a top concern for executives. Tying strategy to HIE development can help solidify functional aspects and implementation timing. When this happens, costs can be more clearly defined and some of those budget concerns can be alleviated. At the time of the survey, most respondents were in the planning stages. And despite the concerns about high startup costs, their overall opinion of HIEs was positive, with 66% saying they see it as a good move for their organization, and 42% saying they believe HIEs will improve patient outcomes. In fact, when asked about their motivation for HIE adoption, patient safety was the #1 reason given, with availability of patient data being a close second. What if you're ready to dive into HIE implementation now? Here are the top 5 things you should consider. First, develop your strategy. If you haven't selected an EMR, get to work evaluating which one will work best with your HIE strategy. Next, determine where your funding will come from. The costs of building and maintaining your HIE won't be fully covered by stimulus funds. Make sure you educate people. Moving things forward requires bold decisions, and when physicians and patients understand the benefits of an HIE, they are more likely to support you. Getting buy-in from insurers and employers is also critical. After all, they have the most incentive to see your HIE succeed. And finally, choose a partner that understands your needs and knows how to tie HIE implementation to your overall strategy. At Beacon Partners, our extensive experience in this area enables us to align your people, processes, and strategy to ensure success. Clearly, HIE implementation is an important topic for today's healthcare organizations. To get more detailed information on this or any of our previous studies, please visit beaconpartners.com. Thanks again for joining us. We look forward to seeing you soon.